Hi, everyone. My name is Emma Congreve, and I'm a Deputy Director at the Fraser of Allender Institute at the University of Strathclyde. Today, me and my colleagues are doing a short video to talk about some of the implications of the Learning Disability, Autism and Neurodivergence Bill, often referred to as the LDAN Bill. We are particularly interested in some of the implications of the bill for people with learning disabilities. And we've been doing lots of work over the last few years, looking carefully at data and analysis that can help the lives of people with learning disabilities. We're using this video to go over what some parts of the bill mean and to give some of our thoughts and a bit of advice on things you might want to think about when responding to the data parts of the consultation. But how you respond is entirely up to you. So firstly, what is data? It's really quite simple. When people tell us about their experiences, this is data. So it's basically information about people's lives, what they do, what they think, and how they feel. When that data is shared and used well, the government can provide the services and the support that people need to draw on. The Scottish Government has admitted part of the reason that data is featured in the consultation is the government knows it does not have enough information on the lives of people with learning disabilities. Without this data, they do not know what is happening to people or what needs to be done to make their lives better and to ensure their human rights are met. The LDAN Bill could help with all this. It could place duties or expectations on people who collect data to ensure they're doing this well and the data can be used to make effective policy.
Hi, I'm Kirsty McFadden. I'm a Knowledge Exchange Associate from the Fraser of Allender Institute, and I work on our current Learning Disability Research Programme. So, Emma's talked about what data is and why it's important more generally, but why is it important for the LDAN Bill? Well, the goal of the LDAN Bill is to uphold the rights of people with learning disabilities and people who are neurodivergent. And we're starting from a pretty poor place. People covered by the LDAN Bill face a lot of discrimination and inequality. This means that we need to be able to measure progress and track whether improvements are being made when it comes to people's rights. And at the moment, we don't even have good basic data. Did you know that in Scotland, it's difficult to even count the number of people with learning disabilities? We made some recommendations last May about data, and we're really happy to see that our work has been mentioned in the LDAN Bill Consultation. We recommended that a dataset called LDSS, which hasn't been published for the last 3 years, was reviewed to see if it could be restarted, and the Bill Consultation says that this is happening. We also talked about annual health checks, and it's good to see that progress is being made in this area too. We agree with what the LEAP panel had to say about data. We need to improve data collection on key issues, prioritise disadvantaged groups, and include lived experience in data. We also agree that people with learning disabilities and neurodivergence should be included in decisions about data collection and reporting and be able to access their own data. We're really glad that data is an overarching theme in the LDAN Bill consultation. It's crucial that we have good data to track improvements for people with learning disabilities and neurodivergence. We also think that data needs to be considered alongside some of the other overarching themes, especially inclusive communication. If people with learning disabilities or neurodivergence can't take part in surveys or share their insights due to data collection being inaccessible, then we can't collect the data that we need.
Hello, my name is David Jack, a Knowledge Exchange Fellow with a background in statistics here at the Fraser of Allender Institute. So let's go on to discuss the 4 proposals set out in the overarching data theme within the Learning Disabilities, Autism and Neurodivergence Bill consultation. The first proposal states that if a commission or commissioner is created, their functions could include responsibilities for collecting and analysing data on neurodivergent people and people with learning disabilities. Additionally, it goes on to say that a body could have powers to make recommendations to other organisations around the appropriate level of disaggregation, or in other words, the level of detail of the data. Now, as we've said before, this is an area where policy and the provision of services are at risk of being crudely informed by data which is available, but not fit for purpose. Therefore, collecting more relevant data at the appropriate level of detail would be greatly welcomed. This will have the biggest impact by being considered alongside pushing for enhancements to existing data collections. And this could include sources such as the Office for National Statistics, who are responsible for the likes of official labour market data. Improvement activity should start with the tightening up of definitions and ensuring a much higher level of consistency across data collections. This would make it much easier to connect different data together and to draw out the insights which would inform good policymaking. Overall responsibility for this does need to be thought about carefully, especially in relation to the role of the Scottish Government's Chief Statistician, who is ultimately responsible for ensuring adherence to the Code of Practice for Statistics and setting Scottish standards for statistical classification, methods and reporting. Moving on to the second and third proposals. Now, these appear to be interlinked. Proposal 2 covers placing duties on relevant public bodies to collect data on neurodivergent people and people with learning disabilities, where this would be helpful for better understanding the needs of these groups, understanding their experiences, and informing service design and improvement, and also to allow for the evaluation of outcome measures. With Proposal 3 indicating that these public bodies then return this data to the Scottish Government. And we would imagine this to happen on a fairly routine basis, perhaps quarterly. So, this once again offers encouragement that data in this area can be improved, with the limitations and gaps in the current evidence base tackled through more relevant and timely data collection. But simply put, these proposals need to be backed with a plan to enhance analytical resources. To be effective, improved data collection would require better guidance to be produced, collection methods to be carefully considered, and quality assurance processes to be developed. Enhancing the evidence base through the collection of more relevant data is only going to be truly worthwhile if there's also investment in the analytical capacity to robustly collate and analyse this information. At present, the analytical support for this area of policy within government in Scotland appears to be far too limited. This resource needs to be boosted, along with more opportunities to bring expertise together to ensure data improvement work can thrive, as opposed to being hindered by being done in silos. So moving on to the fourth and final proposal, and this is to consider the development of a Scottish version of the Learning Disability Mortality Review, or LDAR programme. LDAR summarises the lives and deaths of people with a learning disability and autistic people who died in England in annual reports. Once LDAR is notified of someone's death, their case is referred to a reviewer in the person's local area. A LDAR review looks at key episodes of health and social care the person received that may have been relevant to their overall health outcomes. With this proposal, first and foremost, we would trust that the thinking would be informed by Healthcare Improvement Scotland and the work on the Scottish Mortality and Morbidity programme. The level of resource required to develop a Scottish version of the LDAR programme is unclear from the bill consultation. And whilst the aims of the programme in England around reducing health inequalities and preventing people with a learning disability and autistic people from early deaths are clearly very, very important, this might be something which can be initially considered alongside the plans for data generation and collection through new annual health checks for adults with a learning disability aged 16 and over across Scotland. It is expected that each health board area will offer every eligible person a first check by the 31st of March this year, 2024. Now, if appropriate resources are dedicated to considering the data that starts to become available through these annual health checks, what it can tell us, and perhaps what it can't tell us, then this may help inform the suitability as well as the shape and scope of a Scottish version of the LDAR programme, including how it could be managed and effectively resourced. So, in summary, these proposals could make a positive difference in improving the data landscape for neurodivergent people and people with learning disabilities in Scotland. But it is unlikely that this would be achieved through all four proposals being applied simultaneously. So as part of this consultation process, it is therefore critical to think about what would add the most value and when. Data is an overarching theme for this bill, and it needs to continue to be thought about in this way. And most importantly, any proposals which are agreed need to come with a genuine commitment to be supported by improved levels of resource, which can not only be developed, but also sustained over time.
We hope this video has given you some more insight into why data is important for the LDAN bill. The more people who are able to respond to the consultation, the better the outcomes are likely to be. If you would like to respond to the consultation, we've left the link to do this in the description of the video below. We have also linked some more resources about the LDAN bill, which could help you to answer more of the sections in the consultation. This includes easy reads and recordings. Thanks for listening.